like for this afternoon. Thank you so much because I forgot that at the moment. So thanks to whoever just recorded. First, we will kind of go over a welcome and some council business. And then we have a variety of presentations as well as program updates, which is always great. We look forward to a presentation from Chris with the Colorado Cross Disability Coalition. And then we'll have some other program updates, including that from the Colorado Social Health Information Exchange, some updates regarding Money Follows the Person, as well as the InReach program. And then lastly, updates on the long-term services and supports presumptive eligibility program. And then at the end, as always, we will have an open forum time for comments, questions, updates, anything that you all want to share. Oh, you can't see the agenda. I apologize. Am I not sharing that? Let's see what I can do here. Sorry about that, Peggy. I thought I was sharing.
I can see it.
Oh, you can. Okay. Is there anyone else who cannot see the agenda that I'm sharing?
Looks good on my side, Amy.
Okay. All right, Peggy, I'm sorry. All right, we'll speak up if Peggy or if anyone continues to have issues as far as viewing the screen, or anything like that. Okay. And just a note about some housekeeping business. Again, welcome. Thank you for joining us. My name is Amy Dearmore. I work here at the Department of Healthcare Policy and Financing in the Access Unit under Matt Bohannon. And I just want to go over a few housekeeping items. We are recording this meeting. And so please ensure that you do not share any personal or protected health information either verbally or in the chat. We will be using the chat panel to manage questions. So if you'd like to ask or share something, please click on the chat button at the bottom of your screen to type those in as you have them. We will respond to questions periodically throughout the presentation, as well as at the end during our open forum time. You are able to click the CC button at the bottom of your screen to either turn off or turn on the closed captioning feature. And also at this time, the department is not allowing the external use of AI or artificial intelligence note-taking bots in our meetings without an advanced accommodations request. If that is an accommodation that you need, please email John Berry at the email shown on this slide, and he can assist you. Without further ado, I am really happy to present Mr. Christopher Brock from the Colorado Cross Disability Coalition to give us a presentation on legal guardianship versus powers of attorney. And so at this time, Chris, I can stop sharing and so that you're able to share your slides.
Okay, let me do that.
Sorry, I'm slow on the uptake here. Let me. Here we go. Take it away if you're able.
That's oh. 1 second. Can you see that? No?
We can see it.
I can see that, Chris. The guardianship slide.
Yeah, I can see it.
Okay. I don't know why Amy can't. So what I'm here today to speak about is the difference between guardianship and powers of attorney, because some people, it's an easy thing to get confused by. And I've learned recently that, especially out in the community, whether we're talking like nursing homes or caregivers or whatnot, there's a bit of confusion about which is which and what each one does and kind of all this stuff. So I'm here to kind of simplify that and make the distinctions clear. So first, I'm going to start with guardianship. And guardianship is the process by which a guardian is appointed by a court to assist with the personal affairs and make decisions on behalf of an incapacitated adult. A person under a guardianship is called a ward. You'll hear me say that several times. So guardianship is once somebody turns 18 and is a legal adult, regardless of their disabilities, they are a legal adult and they have all rights and that any other adult has. So often these individuals need someone appointed for them to make decisions for them. and that's called a guardian. And in order to do that, you need to go to court. There's a long process for that. There's but you have to petition the court, file a bunch of documents, and then eventually there's a hearing for the court to appoint a guardian for a disabled, or not disabled, incapacitated adult. And oftentimes the guardian is a parent. Occasionally it can be, there are professional guardians out there. Occasionally it can be adult protective services, friends of in these individuals. It kind of runs the gamut of who can be a guardian. And so that's that process. And guardianship, in a nutshell, is taking the rights from the individual, the incapacitated individual, and giving them to somebody else to make decisions. So that's why you go to court, because you are taking the rights away to make decisions from a person and giving it to someone else. So that's why there's a long process to it. That's why it's in the law. That's why it's a hearing, because it's fairly important to make sure all the T's are crossed and I's are dotted, and make sure there's not abuse going on. Let's see. And then there's medical and financial power of attorney documents. These are two distinct documents. There's a medical POA, and then there's what's called a durable power of attorney, but it deals with finances, so we just call it a financial POA. Two different documents. Oftentimes, you do them both. You'll see that, right? If you go to an attorney and you do estate planning and you get your will and whatnot, oftentimes they'll do medical and financial POAs for you. So these are documents in which you designate somebody called an agent to act on your behalf if when you are unable to make informed decisions for yourself. The person signing the POA is called the principal, and the person that is given the authority to act is called the agent. So this is for people with capacity to sign these documents and say, I want my wife, my eldest child, adult child, etc., to make these decisions for me if I'm unable to, if I'm in a car wreck and get a TBI, if I have a heart attack and then I end up in a coma, or if, you know what, I broke my leg, I can't drive to the bank, but I want my agent under my POA to drive there and deposit my check for me, something like that. So POAs are for people with capacity. So oftentimes if you have capacity, you do this. And if you don't have capacity, you do the guardianship. Let's talk about the differences, and that could probably help clear that up a little bit more. When it comes to guardianship, like I said, meant for somebody who is incapacitated, and then the ward needs to be at least 18 when they become a legal adult before you can get guardianship over them. Power of attorney, the individual needs to have capacity to understand power of attorney documents to sign them, and they also must be 18. So if you're 17 and you want to give your mom agent power under a POA, you have to wait till you turn 18 to sign that document. Guardianship requires a court process, like I mentioned, in a hearing. Usually that takes 6 to 8 weeks, so roughly 2 months or so from the start of when you file the petition to the hearing, just because courts are busy, they have a docket, and you need to file several documents. You need to have a process server serve the individual, the ward, serve them at least 2 weeks before the hearing so that they have proper notice that the hearing's taking place. So there's a whole process to it. So it takes a good 2 months, if not longer. Power of attorney, like I said, they're documents, and all that's required is signature. And to dispel any myths, a notary is actually not required. These documents are not required to be notarized. They can be, and I have all my documents I draft, I do put a notary block in them just for safety purposes, and just so in the community, some people think they have to be notarized. So I just do it as a safeguard, but it doesn't by law, it's not required. Just signature of the person's required, of the principal is required. Under guardianship, a guardian is the final decision maker. So that they are, the guardian is the person who makes that final medical decision financially about finances, decision about where somebody lives, kind of all of that stuff. However, the law in Colorado and elsewhere, I presume, is that the ward must be consulted. So throughout Colorado law, there is several provisions that essentially say the ward must be consulted regarding decisions if they're able to the point that they're able to participate in the decisions. Some can participate very well, some really not at all. It depends on their condition and whether they can speak or say yes or no or not or whatnot, however they can communicate. When it comes to power of attorney, the principal, the person who signs the document, they're still the final decision maker. Their agents are just their deputies. Their agents are carry out their wishes, basically. And if they're in a coma, let's say, then the agent, they need to carry out the wishes as best as they know how. What would the principal want, basically? So that's kind of the differences about who makes decisions and who's the final decision maker. Guardianship expires if the court terminates the guardianship or at the ward's death. So the ward doesn't have a lot of say in ending the guardianship. They can go to court and request it and say, I have overcome my incapacity, and often to do that, you probably need an evaluation from a doctor to get that done. It does happen, but it is a heavy lift usually to say you no longer need guardianship. But like I said, it does happen. Or when the ward passes away, the guardianship ends. Power of attorney, it expires either at the principal's death or when the principal say so. So at any time, the principal can revoke a POA. They can do it in writing. They can do it orally. At any time they revoke it, the agent no longer has power. So if you see the difference there, the ward needs to go to court in order to terminate. The principal can terminate whenever they want. A guardian must be at least 21. Under a POA, an agent only has to be 18. So a little difference there in the age. Don't ask me why. That's just what the law says. The law is funny sometimes like that. Guardianship's enforceable nationwide. So if you're on vacation in Georgia, your guardianship still works. You can still use it to make decisions for the ward. However, if you move to another state, let's say you move to Georgia, then you have to go to court to get that guardianship transferred from your county court here to your county court in Georgia. And there's a process for that. Normally, you want to apply for that before you actually move, but a lot of times the guardians, they just don't know that, or the court doesn't tell them, and they move, and then like a month later, they get told, like, oh, you should have asked for a transfer the guardianship to the court in Georgia, and then they do the whole thing and it gets transferred. When it comes to POAs, it's also enforceable nationwide. So if you have a medical power of attorney and you guys are in Chicago and somebody gets hurt, and you can make those decisions. But it doesn't need to be transferred or anything like that. Some people do draft new powers of attorney when they move, but it's not required. If you're still happy with who you name as your agents, your POA from Colorado will still work in Illinois until you revoke it or you pass away. And then some similarities, and this is probably why some people gets confused, is that they do have similar principles. So for guardianship, the ward has a say in who they want as their guardian. Or actually, I'm sorry, this should be differences. But anyways, the ward does have a say in who they want to be a guardian, but the final decision is actually with the court. The judge will take in information from various sources, and let's say, you'll see this. Oftentimes, you'll see maybe divorced parents who each want to be guardian, and they don't want their ex-spouse to be the co-guardian. That happens quite often, unfortunately, or adult children for mom or dad who have dementia. That happens quite often too. One wants to be guardian, both want to be guardian, and both say the other person can't be trusted. It's up to the judge to make that decision, and oftentimes they take testimony, court visitor report, all this stuff to decide who, and they listen to what the ward wants to decide who wants to be guardian. Power of attorney, the principal chooses their agents, and they can choose whomever they want. Usually it is a spouse or an adult child, but it doesn't have to be. It can be a friend. It can be, there's professional fiduciaries who do this for a living. You can name, if you don't have anyone, you can name professional fiduciary as your agent. Both, and then our similarities, both guardianship and POAs can be limited. You can limit a guardianship to just medical decisions, for instance. Same with POAs. You can limit a medical POA to certain decisions, or a financial POA to certain decisions. You can narrow the scope of it if you wish to. Both guardianship and POAs, you have right to all HIPAA protected info. That's kind of the point, is you can bypass HIPAA to talk to doctors, to receive medical information, kind of all of that stuff. And both positions, you are what's called a fiduciary, meaning that you have a legal obligation to act in the best interest of the ward. So not only, yes, you got to abide by guardianship law and what the law of the power of attorney when it says in the document, but also know there are many laws out there regarding your duties as a fiduciary, your legal obligation to do what's in their best interest. Having said all that, even though they have all these laws in the books, there is still abuse in the system. I don't think you can try to legislate as much as you want around trying to get that stuff out of the system, but it happens, sometimes it can be very easy for adult child who has money troubles to notice, hey, mom who made me POA 10 years ago, she doesn't really pay much attention to her bank accounts anymore because she's in a nursing home and everything gets paid for, and she doesn't really check her checking account. So sometimes you get that itchy trigger finger, desperate times, things like that does happen, unfortunately. So they try to get that out of the system, like I said, but abuses like that do occur occasionally. So that's the end of my presentation. So in a nutshell, that's the differences, and that's how kind of the distinction between guardianship and POAs. And I'm happy to take any questions or concerns or confusions, whatever I can clear up.
Much, Christopher. It looks like we did have a question, which is, did you say this already? And I apologize. Does the ward have a say in who their guardian is? For example, if the ward doesn't agree with who is petitioning to be their guardian and they want someone, you got your answer. Sorry about that. I apologize. If you already addressed that, I apologize.
Yes. So I've been in cases where adult, mom or dad wants to be guardian, and adult daughter who happens to be married but is now incapacitated, they want their spouse to be guardian, or even not married, or they want their best friend to be guardian. They don't want mom or dad to be guardian because of something that happened in their past 15 years ago or something like that. So the judge takes all that into consideration and makes a determination. It can be very contentious when things like that happen. I tried to avoid those cases. Most people do, but sometimes it happens.
And then another question came through in the chat. Do you have to resubmit for guardianship annually?
Sort of. So you have a annual report you need to complete and file. It's about 7 pages, and it has to be sent in on the same date every year, and every guardianship is different on when that date is. If you don't submit that by that deadline, the court will send you a letter saying, hey, you didn't send in your report. You have 30 days to send in your report. And then if you don't send it in again, they will say, okay, we're going to have a hearing. Why didn't you send in your report? And then if for whatever reason, you're unable to continue being guardian, or if you don't show up to that hearing or whatever, then they will revoke the guardianship, most likely. So you need to do the report in order for the court to stay off your back, basically, and not revoke it.
Thank you. And one more question. Do you have advice for someone if someone comes across a situation where an individual's maybe caretaker, someone has overstepped their boundaries as far as assuming a role of a POA or guardian without actually having that permission?
Well, yeah, it depends on just how serious we're talking. Sometimes it can be just as easy as it can be, if it's something small, it can be a conversation with, say you're, the caregiver and all the adult children and, good friends or whomever, to say, hey, that's not your role. You can't do that. Let's kind of, step back and let's not do that. If it's serious, like if somebody's being financially exploited, which I have seen before by a caregiver who was a buddy, and all of a sudden their TVs were being bought for them, then you end up going to court, contact police as that can be what's the word, elder abuse or abuse of somebody with incapacity. There are laws protecting those people. So it depends on how serious, but if it is serious, law enforcement, the courts are usually the avenues you pursue. You're muted. Amy, you're muted.
That's exciting. We do have a couple more questions in the chat. One being, since guardianships have to be approved by the court, are those documents public record?
No. The most guardianship court cases are suppressed. So if I want to say, for instance, if I want to file into a guardianship case as a new attorney, I can't just search on the court's Denver District Court docket to find it. I need the specific case number to look it up, and even then, the caption is suppressed. So, like, I need to know what I'm filing into to see it. So, it is usually just restricted to the people involved in the case.
Thank you. And then our last question we have for now is, can a power of attorney make the decision alone without the input of the member for them to remain in the nursing facility, for example, when they want to return home?
In general, yes. So, that's the point of a POA, is to make decisions when the principal is not able to. Now, it can be, you can't override the decision of the principal. You can just, follow the principal's wishes, or if the principal is not able to make those decisions anymore because they can become incapacitated over time, dementia or something like that, then it's in, you're making decisions based on their best interest. If they disagree, even though you feel like, so you have a POA, you're dealing with elderly mom, and that, hey, sorry, but she needs to stay in the nursing home. That's your decision as her agent or her POA. She, while having severe dementia, disagrees and says, I want to go back home. I can take care of myself. The POA can only go so far. You can't, like I said, you can't override the decision of the principal. That's when a lot of people go pursue guardianship. And they say, well, unfortunately, mom, you're not able to make those, that's not a safe decision. I don't think you're really understanding what that means. Your dementia has taken over, and we can't, you can't make safe decisions for yourself. So I need to go to court and take those rights. And so that's what some people have to do.
Information. Thank you so much, Chris. Is it okay if I put your email address in the chat so if folks have follow-up questions, they can reach out?
That would be great.
Okay, great. It's there right now. Wonderful. Thanks again so much.
Thank you very much, Amy.
And now I think, Chanel, you wanted to kind of introduce our
Yeah,
next.
thanks, Amy. So for our next portion, we are going to have a presentation from Melissa and Kathy, and they're going to be talking about the Colorado Social Health Information Exchange, or COSHI, and JotForm. The InReach team and the Compliance and Innovation Division are going to be using a combination of these two systems to kind of help streamline the transition process on the options counseling side and the local contact agency side. So right now we use a Google form, and that will be changing in the next month or so. So we just wanted to kind of come here, give a presentation, get some feedback. Most of you that are in options counseling agencies have met Kathy and or Melissa at one point or another, but we also wanted to share with all of our TSAC stakeholders. So I will hand it over to Kathy and Melissa. Thank you.
This is how I feel to put Melissa's last name on here. It's Melissa Gillespie. So sorry about that, Melissa.
Well, thank
and
you.
I'm happy to run these slides for you if you'd like.
Oh, if you have them, great.
Yep. And you should be able to see them, hopefully. Can everyone see the slide that says Colorado Social Health Information Exchange?
Yes.
Excellent. All right. Give me just a second here.
Great, next slide. So as Chanel said, my name is Kathy Lofi. I work for Resultant, and Resultant is a company that's been hired by the Office of eHealth Innovation to build the technology platform for the Colorado Social Health Information Exchange. Next slide. So just over the next 5 to 10 minutes, where Melissa and I are going to quickly just give you an overview of the Colorado Social Health Information Exchange, share some information about the first use case, which is the first way we're going to use this exchange. And it happens to involve option counseling referrals being sent to option counseling agencies. And then Melissa is going to talk to you in a little bit more detail about the specific changes to the option counseling referral process. Next slide. So basically, the Social Health Information Exchange is a program to help better exchange information between health providers, behavioral health providers, and social health providers. And the whole purpose of the exchange is to better meet the health-related social needs of Colorado residents. And it's really important that we meet people's social needs because we know that it's the social and economic factors in an individual's life that really drive their health outcomes. And we also know that health and social care data systems are very siloed. And that leads to many challenges, particularly around the delivery of services and making the delivery of services efficient for the person delivering the services and the person receiving the services. And as a result, often people need to coordinate their own care. So the whole purpose of the COSHI program is really to help break down some of these data silos so that people have, particularly care coordinators, have the information they need to effectively serve their clients. Next slide. So as I mentioned, the whole purpose of the program is to securely share physical, behavioral, and social health data to help better meet the social needs of Medicaid members and to improve their health. There are a couple different components of the Koshi program, which you may hear about. First of all, there are going to be regional hubs, which are regional systems and networks of organizations that work together to share information. And then there is the statewide unifying architecture, which is going to connect a lot of the local and regional referral platforms. And then consent is also a key component of the program because we only want to be sharing information that individuals want to have shared. Next slide. So the first use case, or the first way we are using the Koshi technology, is by taking referrals for options counseling from 3 different sources. So you all are probably familiar about referrals coming in through the Medicaid Transition to Community Request Form that's on the HCPF website. You may or may not know that referrals for options counseling also come from the PASSAR Level 2 evaluation and then the MDS assessment. So these referrals are all being ingested into Koshi in a more streamlined way as they currently are. And our referrals are being generated to options counseling agencies through a portal that we have built. I'm going to turn it over to Melissa to go into a little bit more detail.
Thank you, Kathy. Just to introduce myself before I get started, my name is Melissa Gillespie, and I am the Social Determinants of Health Business Analyst at HCPF. And like Kathy said, we work closely on this project. So you can go ahead and go to the next slide. So these are just a couple of slides to just give you a sense of where you will be able to find the links to the form. So currently this is where the form is available on the website, and we will be updating the link to the new JOT form once it's ready to go live. So you can still find it in the same location. Next slide. And then this is just the first page really of the JOT form. So we have set it up so that it is accessible and HIPAA compliant. Next slide. Yeah, so the main changes is obviously moving from Google Forms to JOT form. Like I mentioned, JOT form is HIPAA compliant and also has more accessibility features, which is a good improvement. The other changes you'll see will be just the order of the questions. That was mostly changed so that we could set up form logic, basically so that only fields that need to be filled out based on the answers that are entered are visible. And then we added in some data validation, which will help us improve the data quality of the information that's submitted. And then there's also a CAPTCHA at the end that will just make sure that no bots or anything like that can submit a form. Next slide. This is just an example of what the portal looks like. So once the referral information is ingested into Koshi, then it will show up on a page that looks like this for the options counseling agency to accept or decline the referral. Next slide. Thank you. The other change that we are making is we will be updating just the formatting for the options counseling monthly referral report. There is an option within the portal to export some data. And so we wanted to make sure that the file that's exported and the options counseling monthly referral form match so that there can be as little data manipulation as possible in order to be able to submit those reports via the SharePoint site. So we will update the link once that's ready to go. Next slide. And then this is just an example. So basically the columns B through M will be exported from Koshi, and you can just copy and paste. And then anything that doesn't have information from the export will just need to be hand entered like it currently is. All right, and I did see a question come up, so I'll just go ahead and take that now because that was the end of this slide. Frank, hello. So to access the portal, we will need the ping ID, which I know some folks helped us with testing. And that was something that we were kind of still working through some of those details. So the ping ID will be used, and we are continuing to troubleshoot that piece. Kathy, I don't know if you have anything else to add to that.
No, the only thing that I'll add is that our current plan is to go live on November 12th with the Koshi platform. And we have been talking about how we want to be able to get the users their ping IDs and make sure that they have access to the system prior to that date. So we'll be working with you probably in a training the week before go live to make sure that folks can access and get into the Koshi platform.
Awesome. Thanks, Kathy. I think the next slides are just some links to resources and then our contact information, but we'll go ahead and include our email addresses in the chat, and then we can also include a link to the slide so that you all can take a look afterwards. Any other questions?
So much, Melissa and Kathy. It's really exciting to see what how this program is developing. Really excited to see where it goes as well. Thank you so much for the information. It looks like now we are ready to hear some updates about Money Follows the Person from Matt Bohannon.
Hello, everyone. Oh, there we go. Hi, everyone. I will be brief. I just wanted to keep people kind of apprised of where we are with Money Follows the Person, and speaking specifically of the new demonstration. So Money Follows the Person as a federal grant program. We have been working and talking with all of you about the demonstration that we anticipate launching January 1st of 2025. So since we are quickly coming upon those dates, I just wanted to give you a little bit of sense of what to expect and look for as we approach. So we are currently working on the development and distribution of training materials as well as operational guidance. So we will be sending out information in a couple of different layers. With both the memo series and with our training and presentations, we will have an informational memo and then an MFP overview training that will very much mirror the same level of detail. They will provide general stakeholders with an overview of what Money Follows the Person is, what they can expect to see in Colorado, who this program serves, and how to access. So within this next month, at some point in November, we're hoping that that information will be released. Concurrently, we are also working on operational guidance through the form of both memos and trainings. So within our operational guidance, the memo and training, again, will mirror the same level of detail, but the operational side of things will get much deeper into the actual program. We'll talk about the services, how those services are built, who the providers for these services are, what claiming looks like, and so on. And so that will be released in a very close proximity to the informational memo and scheduled in close proximity to the MFP program overview. And then additionally, we want to make sure that people have as much runway as possible. So if you are a provider that's interested in participating in this program, we will also be releasing information specifically regarding provider enrollment. We'll share some resources with you from the state resource database that will walk you through the Medicaid provider enrollment process and talk with you about how to add these new programs to your service offering. So with all of that, then the last things I will leave you with is that kind of to tie all of this up, once we are in place with implementation, we are also currently working on our Money Follows the Person billing guide with the goal of having that ready for rollout alongside of our Money Follows the Person implementation. And that will be a desk resource that for those of you that are actually supporting the program in an ongoing basis, will provide that information so that you have it at your fingertips understanding that you're not going to remember everything that comes in training or memo. That will be something that you'll be able to use throughout your program. So that's all I wanted to share. I just wanted to give you a sense of when and what to expect in these next couple of months. But if there are any questions, I'll hold for a second before I hand it over to our next person. Having paused and seeing and hearing no questions, then I would like to hand it over to Jay Jackson, who will talk with us all about the Money Follows the Person capacity building grant that she oversees.
Thanks, Matt. Good afternoon, everyone. And yes, I am Jay Jackson, working on the Money Follows the Person capacity building grant. So I'm going to use this opportunity just to highlight the grant a little bit and give some updates about it. And then actually next month, I'll do a deeper dive and talk more about the grantees and some of their programs and things like that. So this grant is in conjunction with Money Follows the Person, but it is aimed towards capacity building. So it was a grant opportunity that was available to organizations in the community for them to enhance delivery of Colorado's transition services. It was an opportunity for them to come up with some solutions to build capacity, streamline access to services, and improve business processes to support institutional transitions here in Colorado. So some of the activities that are some of the goals that we are working towards with this grant are listed there on that slide. And I said some of them already: building awareness of the transition services, strengthening community collaboration, and supporting individuals as they transition to community living. I also want to just talk about how this is about building capacity. So although we are interested in the transitions that are occurring through these organizations, building the capacity is the goal of the grant. So there's a lot of staffing, there are outreach activities and things like that that I will go into here in a couple of slides. Next slide, please. I want to talk about some of the grant details. So this grant, the application process was at the beginning of this year and it closed in February 2024. The maximum award amount is up to $90,000. Now that does vary among the grantees, but the maximum amount was $90,000. The grant term is 12 months and we are about 6 months in almost now working on the grant. So that's why we thought we'd come in and provide an update on the process and how everything's going. We do have a fiscal intermediary for this grant. It is Public Consulting Group. They handle the invoices and I meet with them periodically to discuss the grantees and any concerns they may have. So those are just some of the overarching grant details. The next slide shows the grantees. We were able to award 28 grantees throughout Colorado, so that was really exciting. We have a lot of grantees out there in the communities across. We have them in rural areas, in the cities, so it's really great that we were able to award so many grantees who are out there doing the work. They're all listed there. I won't name them all by name. Some of them attend this TSAC meeting as well, so some of you may see your name there of your organization. And those are the 28 grantees that were selected and have been working on this since about May. That's when contracts became active, although the process ended in February. By the time contracts were active and everything, that was May of this year. Grantee activities. So there's the part I said about the contracts beginning in May, and some of the activities that they are doing are staffing new transition coordinators, outreach activities in the community with community partners, and health information system updates. And that does include equipment. Those are the three primary activities that the grantees are doing right now that are supporting their capacity building efforts. The staffing and the outreach activities have been the most influential. That's what I've received from the feedback that I've been getting from checking in with the grantees this month. To date, we've spent about $200,000 in grant activities, and we are increasing that as the months go on. So the grant is in a good place for spending. We're catching up for some of in the beginning process of a grant. It just takes time to get things set up. So now the grantees are flowing, they're invoicing, they're catching up. We do have a monthly grantee group check-in session. So we meet every Tuesday. We discuss challenges, successes, and share resources and check in with each other. There is a mid-year report that's going to be due in November for all of the grantees. And I've been doing individual check-ins with the grantees this month here in October and just getting feedback, checking in on their objectives, going over their report with them, and also reviewing their budget. So that is the update for now. As I said, I'll come back in November and I'm going to go over some success stories. I'll highlight some of the activities some of the grantees are doing. I believe I'll have some pictures to share from the outreach activities as well. So we'll do a deeper dive in November with this grant as well. Does anyone have any questions? Okay. Well, thank you for letting me provide that update, and I will see you in November with more information.
So much, Jay, for that update. And now I think Chanel is going to be talking about some updates regarding the InReach unit and programs.
Yeah. Hi, everyone. My name is Chanel Pugh, and I am the InReach team manager. If I haven't met you already, I just wanted to add or come in and just talk about some brief updates from the InReach team. And so when I say the InReach team, some of our projects include group InReach, individual InReach, at-risk diversion, rapid reintegration, and also the transition services escalation program that is coming. Um, so I just wanted to give an update that the group enrage contract is out of clearance and that it should have been sent to the local contact agencies for signatures. So if you have not received one and your agency is doing options counseling with us, please reach out to me or to Susie at her email is Deborah Bachler, so that we can be sure we have the right contact information for your agency. There were a couple of due dates for deliverables for options counseling. So just be sure that you're meeting those deadlines. And if you need extensions or if there are things that are coming up where you are not able to meet those deadlines for any reason, just keep in contact with us so that we can know and understand why those things are happening and maybe make adjustments for following years or figure out ways to support your agency. And then the last thing that I wanted to flag is there has been a desire to have more stakeholder engagement around individual inReach, which will be coming in 2025. And so I wanted to let you all know that we are having a ongoing stakeholder engagement meeting, work group meeting, the last Thursday of every month. And that meeting will be for group and individual. Group will start off the meeting for about 2 hours, and then individual will have the rest of the time. And you can sign up for those meetings at the same link or the same website that you use to sign up for the TSAC meeting for Zoom. So those were all of our updates, but I will open it up for any questions regarding any of those projects. All right. Well, since I am not seeing any, I will pass it back to Amy. Thanks, Amy.
Thank you so much, Chanel, for those updates. So again, I'm Amy Dearmore, and I would like to provide some updates about this new upcoming program, which is presumptive eligibility for long-term services and supports. Some program updates I have to share. The first one is regarding our 1115 application. Today marks the official last day of the public comment period, which is a formal public review and public comment opportunity as required by our 1115 application. If you're not familiar with what this 1115 thing is, 1115s offer states the flexibility to pilot new programs, and our 1115 demonstration is soon going to be up for renewal. And so we're requesting permission to expand our 1115 to include this new presumptive eligibility program for long-term services and supports. At the end of this presentation, or at the end of our time, I will post information if you do want to get in under the gun. It's actually in about an hour and a half is your time limit to review and then post public comments specifically about the 1115 application. So there is still a small amount of time if that's something you're interested in doing. And the public comment, I will say, lasts an additional 30 days until November 9th for tribal consultation. As far as program developments, we have been continuing with a lot of stakeholder engagement. And from that, we have continued to kind of develop and fashion some different program details. Like I said, we've received a ton of great feedback. One really good example is originally when we first started thinking and talking about this program, we had thought it would be a good idea to allow a third party to process the financial eligibility for those going through the LTSS PE process, but we heard loud and clear from our county partners that this is not something that they want to maintain ownership of the financial eligibility process. And so we have, turned back to letting that stay with the county groups. So that's just kind of one example of some great feedback and ways that we've adjusted according to that feedback. As far as stakeholder engagement, since the beginning of August, we have completed a little over 30 stakeholder engagement opportunities from the beginning of August through today. And whether that includes webinars, presentations, meetings, or publications in different newsletters, we have been able to reach a really wide variety of stakeholder groups and will continue to do so. You see on here, we are always open for other suggestions for ways and groups to outreach. And so if you have anything to share regarding that, you can reach out to me specifically or put it in the chat or come off mute and offer that. Lastly, the last bullet point, I typed out our website for the LTSS PE program. On there, you'll find a variety of ways to provide feedback. You'll be able to see an overview via a video, as well as see a slide deck about the LTSS PE program. These next couple of slides, I know that for a lot of folks on this call, this is maybe repeated information, but just in the off chance that maybe folks here are not as familiar with this program, I just want to provide a really brief overview. Essentially, presumptive eligibility for LTSS will allow members to self-declare to meeting functional and financial eligibility, as well as be verified to be experiencing defined crisis circumstances. During the LTSS PE period, individuals will have access to a small package of LTSS services designed to help someone during and through a crisis situation. You can see the crisis situations here that we are considering. They include a loss or incapacitation of caregiver, experiencing a recent acute medical or mental health episode, and or being a danger to oneself or others. And then you can see at the very bottom here, this is not kind of an open-ended, open door program. Through the 1115, we do have budget for this, but it is kind of a limited budget. And we're still working through the exact numbers on this. This is kind of a ballpark idea, but estimating that we'll be able to serve roughly 100 to 200 individuals per year initially within the first phase of this presumptive eligibility program. And then this is to provide a really sky high high-level overview of the process for presumptive eligibility. And so the different boxes that you see represented here are different colors, differentiating the different roles that will be filled for this program. Someone will complete their application online, and that will be routed to who we're calling the LTSS PE Enrollment Coordinator. They will receive and review the application and then send a referral both to the county for financial eligibility processing, as well as to an entity which is represented kind of the third level down by the mauve or pink color, the entity who will be responsible for facilitating this program. This mauve or pink entity, we anticipate they will serve in a really intensive case management role, similar to how our transition coordination agencies are currently interacting with our members. And so there are many more details to share about all of these entities, especially the pink or mauve entity. But basically, the facilitator will help walk someone through their eligibility process, kind of be a mediator as needed between them and the case manager, maybe them and the county, really walking someone through their long-term care Medicaid application process and meeting with the member to make sure their needs are being met. This entity will also be responsible for initiating and authorizing the small package, like I mentioned, of the LTSS PE services. And then down at the very bottom, This individual will also be referred to their geographically appropriate case management agency, who will complete their level of care assessment and other intake steps within the timelines we're thinking that currently exist for these processes. And then, of course, the very bottom right, our ultimate goal is enrollment onto HCBS for continued support. Any questions on this or the previous slide that I shared?
Hi, this is Kara. I'm an ombudsman in Larimer County. I do have a question about presumptive eligibility. So this has raised some questions in the ombudsman world about what happens to folks who are presumptively eligible. They go to a nursing facility, and then if they don't get Medicaid, they have nowhere to go because they don't have a payer source, so no one will accept them.
Yeah, thanks for that question. And so you're wondering about folks who go into a nursing facility under presumptive eligibility.
Yes, correct. And then for whatever reason, it turns out that they're not actually eligible.
Thanks for that, Kara. So at this time, we are looking at not including nursing facility as a service or support offered under presumptive eligibility. That being said, we very much hear and understand that this is a great need that is out there for our members. And I will just say that though this population that needs nursing facility in this way may not be served by LTSS-PE, there are some other initiatives within the department trying to address this specific need. So, yeah,
Sorry,
hopefully that answers your question, but not in the way probably you were hoping.
That's okay. I appreciate the clarification. Will ALR or ACFs be included in this?
So not assisted living facilities at this time either. Just to kind of give you a rundown, I think it was not actually reflected in the slide, and so I apologize for that. But the services that we're currently looking at, including our right now, personal care, personal care provider, homemaker, respite, home delivered meals, a personal emergency response system, and we're also talking through the provision of state plan benefits to be included
thank you
with
so
this.
much.
Yeah, you're welcome. Thank you for the question. Anyone else?
Hi, my name is Kristen Waldrop, and I have a question.
Sure, thank you.
I'm with a home health agency, and they've recently adjusted how PARs are completed. They've taken the case manager out of it so that the home health agency directly submits the PAR, and we are technically not to begin services until the PAR is received and approved, which would require eligibility verification. So how is that going to work?
This is a really good question. I would like to learn more kind of about specifically what you're talking about, Kristen, because we may have some follow-up questions about that. Would you mind emailing me separately? And I'd love to kind of talk through some of that and get some examples of what you're talking about, because it sounds like that could be some good points of consideration for us.
Yeah, sure.
Okay. I will share my contact information when I also share the 1115 information.
Okay.
Thank you. Anyone else at this time? As I mentioned before, stakeholder feedback has been a huge part of really some great productive developments for this program. And so we continue to want your input on a lot of things. But today, some questions that came to our mind is number one, what do we need to consider when identifying the roles and responsibilities for this program? And so that question kind of centers around this part. What are some things we may not be considering or that you want to make sure that we consider and think about when defining the roles and responsibilities? Also, from your perspective, what potential bottlenecks or challenges do we need to focus on? And lastly, as far as current or future engagement, what level or frequency of engagement about this new program would be helpful to you moving forward? And so kind of what we're thinking about there, we've done a ton of different styles of engagement so far between trainings, webinars, other kinds of communication, whether it be email or in newsletters. Currently, I forgot to mention this before, we have some ongoing work groups. And so whether a work group kind of that meets regularly would be something that you would like for your organization, we'd be happy to talk about that. One of our work groups includes leadership from our transition coordination agencies who are meeting on a monthly basis for a few months. Another work group meeting that we're having is a larger group, which includes leadership from our case management agency, counties, as well as Adult Protective Services leadership group, as well as we are having internal work groups as well. And lastly, kind of as a sub point of this third bullet, what type of resources would you like to have available either now or in the future as we move towards implementation for this program? So I will wait a second. That was a lot of questions for this group. So I'll give you a second to digest and see if anything comes up. And I can't necessarily very well at this moment see raised hands. And so I would love it if you could just go ahead and speak up if you have something.
And just so you know, Amy, I'm reviewing the chat and I don't see anything new for you.
Great. Thank you. Right. So in case you have something to share or something to ask and you don't really want to do so in front of the 33 people present on this call, I will provide contact information, like I said, as well as our website where there are lots of places that you can provide feedback or ask questions. So now is the time that we would like just to have an open forum. Of course, we are happy to hear any kind of questions or feedback, but to help guide our thoughts, I just suggested a few items here. The first one being whether you have any questions or comments on any of the material presented. If you have suggestions for future topics, we'd love to hear about that. On the note of future topics, a future TSAC meeting may include a presentation on the client-directed programs of IHSS, which stands for In-Home Services and Supports. I think that's wrong. As well as CDAS, which is Consumer-Directed Aid and Support Services. No, it's Consumer-Directed Attendance Support Services. I apologize. It's been a minute since I've had to name those out. And we also are looking forward to having a presentation from an agency to talk about their successes with community engagement and also some ideas and opportunities for other agencies to employ or consider for themselves. And then any successes or challenges that you wish to share. And then the last bullet, is there anything else you would like to discuss? Go ahead, please. Rhiannon.
Hi, yes. I'm an options counselor over at Dr. Cog, and I did want to bring a challenge to y'all's attention about a recent client interaction that I had and maybe seek some feedback for expectations handling similar interactions. So essentially what happened is I provided options counseling recently to a client who expressed racism and stated to me that she wanted to work with a white transition coordinator. I responded by saying that each coordinator is highly skilled at supporting her transition regardless of each person's identity and background. And I also want to point out that our team believes that we can't enable or accommodate discriminatory choices. So what I did is I just provided her with a coordination agency list to choose from, as we do for every client, but I would like some feedback from the group about similar experiences and expectations for these interactions.
Hi, this is Frank. I'm options counselor here with the Independent Center, here in Colorado Springs. I've run into that too. And what I did for the most part was let them understand, I'm the only options counselor here, but we can get you with the TCA and get that through. And I also spoke with the ombudsman that was there, and I talked to the discharge planner and the social worker there, and they say that this person had made these claims about other people, even Caucasian people. So I just took it with a grain of salt, but I tried to get them the information that they needed without escalating the situation.
That makes sense to me. That's a similar approach for us in terms of just providing them with that information. We just want to make sure that we don't enable any discriminatory choices. And I wasn't exactly sure what the expectation would be directly from HICPUF. We just don't want to accommodate any racist preferences. And Frank, thank you so much for sharing your experience. That's very helpful for our team to hear as well.
Yeah, that comes also from 27 years of nursing experience in the hospitals where you just kind of walk away from it. Because no matter what you do, no matter what you try, if you get into it with them, or what you're doing is you're just giving them an access to vent ugly stuff. And it's best to just walk away.
And as far as the expectations of the department, I would offer that I think we would love the opportunity to work through any situations with you where you find yourself uncomfortable. Equity and diversity is absolutely a core tenet of the department's approach, and is absolutely an expectation that we all live and care in a world where those differences are being respected and valued. So recognizing that every situation is different, and also hopefully you're hearing that nobody would be expected to deal with behavior that makes them feel unsafe or uncomfortable. I would like to extend the opportunity to please reach out to us if you're encountering those sort of situations, so that we can work through them with you. And again, I would just underscore that it is always our hope that equity, diversity, and inclusion are at the forefront of what we do. And so if you're finding challenges with those, let's look at those cases together.
Thank you.
You for that. Thanks for the question, and thanks for the answers. See a comment that says, "Thank you for this discussion, Rhiannon and Frank. I appreciate the department's backup on these issues as well, Matt." Anything else? Anything else that anyone wants to bring up or discuss? Any suggestions for future topics? I'm right now just entering the 11:15 access in our chat in just a second here. Right. I don't hear or see anyone else who wants to speak up as far as input or discussion items. So if there is nothing else, we will just say thank you so much for attending. Thank you for your continued involvement. And it's really a joy to be a part of this group, and we appreciate you all. Before you log off, I do want to also enter my contact information, since that came up a second ago. Here is actually a link to the LTSSPE website, and it has contact information on there, as well as opportunities to provide feedback. All right, anything else from within HICPUF from our team? All right. We will end a little bit early then. Feel free to log off. I can stay on for a few minutes, and maybe others within our department can stay on for a few minutes in case anyone has something that you wanted to talk about or ask a smaller group. Thank you so much. Have a great afternoon.